Hello, everybody. I am Steve Bates, the CEO of the UK Bioindustry Association, and welcome to this BIA webinar on developments in US politics for UK biotech. I'm joined on this broadcast by two great panelists, Steve Usdin, who is the Washington editor and head of policy and regulation at Biosecure, good friends based stateside, and Matt Wetzel, partner at Goodwin Procter, who has been our guide and ambassador on all things to do with US legislation over the last couple of years. So, guys, if you want to join me, turn on your cameras and microphones, and we'll check that we're all working. Matt, you've got a beautiful view there of the Washington Monument. I hope it's not the Lincoln Memorial and the Washington Monument, if I've got it right.
It's a close enough representation of my view out front here, but nice to join you, Steve. Thanks so much.
But Steve, we've just got we got you advertising your Biosecure show there in your background.
Yeah, well, yeah, you gotta promote yourself.
And it is a fantastic show. I always enjoy it, and I always learn a lot, including the definitions of some of the phrases that we use without thinking about them. It's the English language guide and expertise I get from that, as well as the deep insights into life sciences. So you can see that we're going to keep it quite light, and I hope what we can do in this, in a conversational way, is take you through what I think are three of the key areas that we in UK life sciences need to think about that might have an impact from the world stateside. We're going to talk about the Inflation Reduction Act and the impact that that's having, particularly to do with medicines pricing. I know it's much wider than that, but particularly in that context. The Biosecure Act, a much heralded piece of legislation that's supposed to be going through and is on its journey through Washington as we speak. And of course, we're only a few weeks away from the US presidential election, and I'm going to ask Matt and Steve to speculate wildly and inform us all about what might happen with the next administration. So maybe if I could start, Matt, with the IRA. We've talked about this in the past. Maybe give us a sense of where we're at in October 24 on this piece of legislation.
Sure, no, happy to do it. And of course, the IRA has been so prevalent in the industry in the United States and has had its impacts elsewhere, at least conceivable impacts to date. We now have the first set of 10 prices, maximum fair prices from CMS, including sort of an idea of the landscape of the amount of discount that CMS, agreed to off of the 2023 list price. So we've seen that. We recently had the most recent round of guidance issued from CMS on the Inflation Reduction Act. And next up, we expect to see the next 15 drugs to be named in February of next year, if not earlier, as well as what we're kind of anxiously awaiting for, which is CMS to issue its justification for the maximum fair prices that were just released. In other words, we've got to wait a little bit to hear CMS's thinking on this topic, but that will give a lot of insight into the future negotiations, how CMS, the Medicare program here in the US, handles those negotiations and the like. Of course, on the judicial challenge front, the judicial challenges continue at the district court or the trial court level, rather. The plaintiffs in these actions, different pharmaceutical companies, pharma, the U.S. Trade Association, the Chamber of Commerce, faced difficulty when it came to motions for summary judgment and motions to dismiss. However, on appeal, we now have at least one case that's being pushed back in the Fifth Circuit to the trial court level. So we do expect to see some further jurisprudence on the judicial challenge front as well. So, it remains to be what I would say a dynamic ecosystem. However, the federal government continues to move forward with the plan to negotiate pricing, and the judiciary continues to move forward with reviewing the various complaints and constitutional challenges.
And do you think we can yet draw a picture about the impact this is having on investor sentiment, or perhaps providing a cap in the total available market in certain disease areas? Are we seeing this systemically yet back its way up through the development cycle?
Yeah, I mean, and Steve, feel free to disagree with me on this point, but what I'm hearing from, clients and others is that it really isn't making that huge of a dent in terms of lack of certainty on deal pricing, lack of certainty on asset valuation like we thought it would. That said, it still bubbles up in the context of things like licensing deals or collaboration arrangements where a biotech and a pharma company might be negotiating a certain business arrangement, and it will come into play. It will be taken into account when it comes to pricing those. But at the end of the day, it remains speculation, but for these 10 drugs that have already gone through the process.
So I'd say the issue with the IRA is that a lot of it is that it's going to prevent things from happening that would have happened in its absence. And it's very difficult to prove that. It's very difficult to convince people, especially people that don't want to be convinced, that that's true. But I believe it is. I've heard from VCs that there's a kind of informal no-fly zone, that they're not going to invest in small molecule drugs for conditions that primarily affect the elderly. That's a kind of like a narrow window, but that's what they've said. In terms of deals, it's interesting. It's created an arbitrage opportunity, really, for the large companies, because if you think about it, if you've got 9 years to get a complete return on a small molecule, you need to launch as many indications as quickly as possible. You can't space them out over time as you would have in the past. The large companies are in a much better position to do that than the very small companies. And they've also got pipeline holes to fill and things like that. So that makes some small molecule drugs more valuable to a big pharma than they are to a small company. And it also makes it creates a barrier, really, for the small companies. They're going to find it very difficult to bring things as far down the line as they would have liked to, or as they would have been able to in the past. Another thing, if you're looking at things that didn't happen or aren't going to happen that could have happened, Henry Grabowski and Joe DeMasi have a really interesting paper that came out in Health Affairs yesterday. For people that don't know, they're kind of the economic gurus of healthcare economics and pharma economics. And in that paper, they look at how the stages, the timing for cancer drugs, for subsequent indications, and for trial starts for new indications. And they basically say, unsurprisingly, that cancer drugs, there's a lot of drug development that has happened traditionally 5, 6, 7, 8 years after, even 9 years after approval. They predict that a lot of that isn't going to happen now. And they say especially pediatric cancer drug development very typically happens after drugs have been on the market for some time. That's likely to fall off. The development of drugs for multiple indications is likely to fall off. And it's kind of like, I don't know, like a boiling the frog kind of thing. You're not gonna see it reflected in the data until there's a lag. You're not going to see it for some time, and that's a concern. So I agree with Matt. It's not like the sky's falling. Where it's not like the biopharm industry investment has dropped off a cliff or something like that. But I think it's also wrong to say that the IRA is not having any impact. The third thing that I would highlight is there's a real concern among rare disease advocates that they're gonna take a hit because there's the single designation, the exemption for a single designation, which means that companies aren't going to they're not going to develop drugs, orphan drugs, typically for more than one indication, and they may drop them entirely because it may be that they're profitable if you could do them for several indications, but they're not for one. And one last thing is the impact on biosimilars. It creates, if you think about a biosimilar, basically a biosimilar, typically the investment in it is north of $100 million. And typically they come onto the market at something like a 40% discount from the branded product, the reference product. If the reference product has had a big whack in their price because of the IRA, then you're going to have a discount from a much lower price. That makes it much less attractive to do it. it's very difficult to predict in advance which drugs are going to be subject to the IRA, given the fact that there's a very long time scale that you have to develop a biosimilar. There's already a lot of biologics for which there's no way that there is going to be a reasonable pathway to get a return on investment through a biosimilar. This is going to narrow that down even more.
No, it is really interesting. You think about it. We spend a lot of time. I know you do in DC. We also in Europe and the UK thinking about what are the policy incentives to get certain types of activity. And rare disease is one. Obviously, the BIA and you guys have been close to down the years. And these unintended consequences or the dogs that aren't barking as a result of these changes are really interesting. And it does. That it does change it's interesting, the sort of arbitrary nature of what goes on the list is sort of the interesting thing that's very hard to get right. And Matt, you're suggesting that we're going to see some of those in the next quarter, and again that might be important to have an understanding. Suddenly if your drug is in an area where suddenly that's on the list, it could either affect you as a competitor, or you as a fast follower, or you as a biosimilar.
Yeah, I mean, I think that if you're, you have a sense of whether you're, within the top 50 Medicare spend drugs as of now. So, I don't think that the selection of the next 15 will be, much of a surprise to those who are selected. I do want to emphasize on the rare disease front, though, you mentioned policy incentives. I think this is where, we do have a little bit of an opportunity with the election coming up to be thinking about potential legislative fixes to the IRA. Recall that the IRA itself, the actual statutory language, is quite detailed. So any shift here in terms of things like the rare disease exception, orphan exception, rather, I should say, that would have to be done legislatively. And so I do think there are some of these areas in the IRA that are maybe fixable. I don't know if they're a perfect fix to all the issues with the law, but certainly that rare disease exception, certainly the idea that the small biotech exception should really be about small biotech companies and should not necessarily be time limited, encouraging innovation through, through various incentives that way. So I think that, there's areas of the IRA that we could conceivably see some cleanup over the next year, if, regardless of whether the administration changes as a result of the upcoming election.
Thank you, and it's interesting for me to reflect on this from a UK perspective, because I'm seeing that in the new UK Parliament there's certainly talk about whether a private members bill will be brought in around incentives for certain types of drug development, particularly as a result of some parliamentary talk. So we may see parallels between some of the detail that you're talking about in terms of the development in the IRA with some of that thinking coming across to the UK Parliament in the next period of time. It won't be a government-sponsored bill here, but it would be a private members, a backbench bill in the UK Parliament. And I think people are looking at the experience of the paediatric plans incentives that you've seen in European legislation. Obviously, we're no longer bound by European legislation, but they're thinking, are there tweaks and that could be done on the margins of UK legislation that could drive some of that incentive? Is much harder with a smaller market. Obviously, everyone will do what the US says, but I think we may see some of this washing across to our shores.
Well, and I think the pediatric area is really interesting, and I think it's an area that's going to be hurt by the IRA, because if you think about it, the incentives in the United States, you get a 6-month market extension of your market exclusivity for conducting pediatric trials. Well, that is not affected. That doesn't change the timing for the Medicare price setting, right? So if you've got a drug that's going to be subject to Medicare drug price negotiation program, getting an extra 6 months of exclusivity really doesn't do you any good. And that's going to be very problematic. And I say one other thing that is interesting is to look at it on the other side, which is access. When the law was created, there was an assumption that patients, the beneficiaries, are going to get access to these lower prices. There remains to be seen whether that's really going to happen. It's very complicated to get into the details of it, especially for anybody who's not really intimately familiar with Medicare in the United States market. But there are formularies that govern what the co-pays are and how easy it is to access things. And there are ways for Medicare plans to prefer drugs that they're going to get much higher rebates on. And they're not going to be getting those rebates on the drugs that have been negotiated.
Yeah,
I
it's really
couldn't agree with you more there. I think that's such a great point. I mean, if you think about the IRA, we hear a lot of kind of talking points around, you know, savings for Americans under the Medicare program, but in reality, the negotiation program only saves the Medicare trust fund, the government fund that, you know, actually pays for the drugs. We're looking at selecting drugs based on how much did the Medicare program spend writ large across the whole system, not, you know, just, well, this particular drug has a high out-of-pocket cost for patients, so we want to put that on the list. Or, you know, we know that, you know, most Medicare patients are on XYZ drugs, so this should go on the list. It's just really about what were the total dollars that the US government spent across the board. And so you see that, you know, translating that, as Steve so rightfully notes, that translating that into the actual dollar savings to Medicare beneficiaries is complicated and you know, may ultimately, you know, not bear that much fruit.
Thank you. It's very interesting for those of us who live in a nationalized healthcare system environment with where prescription charges are no more than a little over £10 UK sterling. It's always a fascinating difference between the UK and the US system, and the complicated nature in which the middlemen sit between those various schemes, and the discounting is what I know keeps lots of people in jobs, but it's not one that I can follow in detail. But I think, thank you, that's been really useful.
It's a good way of putting it. It keeps a lot of people in jobs. It's a good way of putting it.
Maybe we can turn to the Biosecure Act. Steve, I think this is having although it's not, tell us where it actually is at, because we talk about it as an act, but it's not actually gone through yet, has it?
No, it hasn't, and it is far from certain that it will. Okay, so it has been passed by the House of Representatives. Notably, about 70 votes. There were about 70 votes against it in the House, mostly Democrats. It hasn't been introduced as a standalone bill in the Senate, and it won't be introduced as a standalone bill in the Senate. It has to be, of course, for the most straightforward path for law is for it to be passed in the House and the Senate and signed by the president. That's not going to happen here, okay? So then you have the possibility that it would be added as an amendment to legislation that has to pass, so-called must-pass legislation. The most likely vehicle for that is the National Defense Authorization Act, the NDAA. So what happened there? First, in the House, there was an attempt to get it into the NDAA, and it was ruled that it wasn't germane to the bill. Parliamentary procedure is very detailed, but anyway, it didn't make it into the House. In the Senate side, there was what they call a manager's package of amendments. Those are things that both the Democrats and the Republicans agree on that are non-controversial. There was an attempt to get it into that package. It didn't make it in. So it still could get in, right? Okay, there's two pathways now, two realistic pathways for it to happen this year, okay? It could still get into the National Defense Authorization Act after the elections. Democratic leadership and Republican leadership in both houses of Congress are going to get together and they're going to agree on what the bill is, okay? They could at that point say, okay, let's put this in, let's put Biosecure in. That will not happen if there's anybody in leadership who digs their heels in and says, no way, I don't want this, or it's not ready. Because the time is so limited, there's no time for back and forth and everything like that. Anything that doesn't get consensus among the leadership gets kicked out. There's horse trading that goes on. Somebody says, oh, I want this. And the other side says, okay, if you want that, you got to give me this. And all of that happens in smoke-filled rooms in the dead of the night. And we won't know what happens until it happens, really, until just before it happens, okay?
Yeah, we have a similar process in Westminster, which we call the wash-up process. At the end of a parliament before the general election, you have a sort of a mad week in which, if everybody agrees it can sort of go through in about 10 minutes. But it's that sort of process that you've got with the Congress, the president wants to be through the election, isn't it? But it's you have a better name for it than wash-up, I hope.
So I don't know if we have a good name for it. I think it's just business as usual. So I mean, I call it do tomorrow, do tomorrow. You know, you know, these things, the Congress goes on for 2 years and everything happens in the last 10 days. The other possibility is it could be added to another must-pass bill other than the NDAA. I've been talking to people up on the Hill about this. They say it's not very helpful. They say it's a toss-up. It's about 50-50 as to whether it really happens. There's one more possibility, which is that it could be changed in order to satisfy the concerns that have been raised by some of the Democrats about the bill, and those are around due process and fairness. I find that a little bit less likely to happen just because it's complicated. It would need a lot of agreement back and forth as to whether to make it happen or not, and there just isn't much time. So that's a possibility, but less likely. Anyway, I would say it's about 50-50 that it happens this year. If it doesn't happen this year, it's not going away, but it will be slowed down and take a more deliberative path and probably be substantially changed if something happens in the new year. And I think that the way that it would be changed is that they would probably strip out the names of the companies that are designated as so-called biotechnology companies of concern that have these kind of sanctions imposed on them. Instead, they would have a process by which they would determine, by which a federal agency probably would determine whether a company is a biotechnology company of concern, that is, whether it poses a national security threat, and there would be more process around the whole thing. Anyway,
because if you think,
a long answer.
No, thank you. If you think about it, I mean, I was thinking about this before it came on. I was thinking the name doesn't really match what the bill does it? I mean, it's not about protecting the spread of disease or infection from a person, an animal, or place to another. It's not about zoo enclosures or anything like that. It is actually a list of companies which are designated, and that does seem at some distance from. I mean, you know, does the name match the policy?
No, of course not. And there's a good tradition of that in Washington. People have these names, and then they kind of grab onto them, and they think, well, that it kind of reminds them of something. I mean, most favored nation, which is what the Trump administration called their international reference pricing bill, had nothing to do with most favored nation policy, which is something that's been around for decades and has to do with international trade rules. So yeah, this isn't really about biosecurity. The other thing is, though, which is interesting, is what is it really about? What's the purpose of it? And that's a kind of a Rorschach test that I have when people who are supporting it, I ask them, what's your goal? What are you trying to achieve? Yeah. And it's really interesting because people say different things. The people who actually wrote the bill in the first place, they're the same people that created the TikTok ban, the limits on semiconductor exports and semiconductor manufacturing exports, and bans on Huawei and things like that. Their goal really is to limit the Chinese capacity in certain strategic technology areas. Okay, that's really their goal. There are other people whose goal is to ward off some kind of what I think actually are imaginary threats having to do with genetic enhancement of soldiers and genome-based weapon systems, which members of Congress have publicly said that that's what they're concerned about. But then it's kind of evolved into something else, which is something I think that there's a broad agreement about, which is the need for more resiliency in the U.S. supply chains, and to be able to manufacture and to have the whole value chain for biomedicine either in the United States or nearshored, in allied countries, and not be susceptible to the kind of disruptions that would happen because of natural or man-made disasters. And that's a much more there's much more consensus around that. And that's what the more thoughtful people who are pushing the Biosecure Act
Yeah.
are aiming at.
Which
Matt,
is where
how-
I almost think that misnomer might come from. The biosecure misnomer might be about the idea of sort of like the security of the biotechnology industry. But I agree with you. I mean, it's sort of like the Inflation Reduction Act, right? You know, the name itself does not describe the actual impact there. You know, I would say too, Steve, your points are spot on, and you know, really, you know, I'm hearing the same things myself. It's as if the geopolitical bell with China has been rung, and it's difficult to unring that bell at this stage. I mean, I just think about things like, we've seen an increase in FDA inspections of Chinese facilities on the medical device side. We've now seen queries to FDA from Congress about biotech new drug approvals with clinical research that's been conducted at Chinese military hospitals, and inquiries into what FDA's position is on that. We've started to see inquiries from NIH in the context of different grants and contracting scenarios where they are interested in understanding the scope of work that's being done with Chinese CDMOs and CROs. So to the extent that Biosecure does not pass this year, which Steve, I agree with you completely. 6 months ago, we probably would have been saying something a little bit different, but the prospects look a little bit kind of dim at this point. But I don't think that this is going to go away. I think that, as Steve, you so artfully noted, that we'll see a perhaps more well articulated version of Biosecure that might take into account some of these other aspects as well. But certainly the idea of some form of due process and ability to sort of have maybe more clearly defined criteria around how you get on the list and how you get off the list, so to speak.
I think the other thing that's interesting to do is to back up a little bit and say what the law does, what the law seeks to do, because I think there's also misunderstandings about that. There are people who portray it as saying, it's just going to create a firewall between the U.S. industry or anybody that wants to market a drug in the United States and obtaining services in China. That's not actually true, okay? So what the law does is it bans the federal government from contracting with biotechnology companies of concern, WuXi AppTec, WuXi Biologics, Complete Genomics, BGI, and other companies that might be added. It prevents them from contracting with those companies for goods or services, okay? So, big deal. Medicare, Medicaid do not contract for drugs. They reimburse for drugs. So the law does not prevent Medicare or Medicaid, doesn't change access to the Medicare or Medicaid markets. The Veterans Administration, the Defense Department, NIH, they contract with Chinese companies. What some of Matt's colleagues in the bar in Washington, D.C. have told me is that there's not going to be any effect on companies that do preclinical, that use these specified companies for preclinical research, for clinical trials, for manufacturing substance that would be used in clinical trials, for any number of things. Of course, the problem is, if you're looking at biologics especially, it's very difficult to disentangle things. It would be very difficult for companies to start down the road with one of these companies and then transfer it over. It would be easier to do it with.
I do think there are two potential implications, though, to be mindful of at the preclinical stage. And number one is whatever research that a company is doing with a U.S. research site, for example, a big academic institution that itself might receive an NIH grant. When you're talking about, under the Biosecure Act, grant funding, specifically, the law says that a recipient of a U.S. government grant can't use those funds in connection with research or other services that involve, at some stage, one of these biotechnology companies of concern. In fact, we've already seen it where research sites are putting restrictions on the ability to work with WuXi and other named entities in their research agreements. And then I would also highlight, too, that agreed that Medicare and Medicaid are reimbursement regimes. However, that VA federal supply schedule contract is really the linchpin that allows the VA, DoD, and Public Health Service to purchase drugs, as you note. But if you don't have a VA federal supply schedule contract in place, you can't receive Medicaid reimbursement, nor can you receive Medicare Part B reimbursement. So while you could still receive that Medicare Part D pharmacy benefit, because that is not tied directly to the VA federal supply schedule contract, the statutes are interwoven so that if one domino falls, the others fall as well, conceivably. And I think that's where we could see some, to the extent Biosecure doesn't pass now, that's where I think we could see a better articulated version of it to make it really clear. What do you mean by this? It was obviously written by folks that had kind of an initial reaction, and then some nuance was added later. But, it's got to be really clear on that front, because the level of uncertainty in the industry right now is just absolutely through the roof, and even more so than when the IRA came out. And so even though this is kind of going nowhere, it looks like it might be going nowhere, there's still so much interest in these Chinese relationships. So Steve, I think you put that really, really well.
I'm sorry, there's two things. I anticipate your question. One is, how does this affect UK companies, right?
Yeah.
And the answer is, it affects any company that wants to sell their drugs in the United States. The same. It doesn't matter. It doesn't make any difference if you're a UK company, US company, a Swiss company, whatever. Any company that wants to sell, or a Chinese company for that matter. Any company that wants to sell their drugs in the United States is going to be affected regardless. And I still think it's 50-50 whether it happens. I wouldn't say that the prospects are dim. I just think it's kind of like, who knows,
Yeah. No, I think it's interesting, that point, Matt, about whether the veterans contract is the key to being able to to meaningfully be able to sell your product into the US market. And if you're a biotech and you're going to try and flog it to somebody who's going to want to enter the US market, if you've got a problem that if that feels like a problem, my sense is that lots of investors are already moving, because they just say, well, the way to solve this is not to have this in my development pipe. Although I've had excellent experience with excellent companies, I can just remove this risk by going elsewhere, except where if I can't find capacity. And then there's all that discussion about how long will it take, and will there be, grandfathering for a period of time, and when will that go to? So I suppose my question here is, do you think it's already had its impact? Because without anything passing, and actually the sector has moved already, or do you think that there's still a wait and see group that are waiting to see?
Both. It's had an impact, of course, because we're talking about it, and it's being talked about in every boardroom of every biopharma company probably in the world. So yeah, it's had an impact. On the other hand, there isn't a huge amount of capacity and capability to match what people are getting from the WuXi AppTec and WuXi Biologics and their subsidiaries. So there's also a certain amount of wait and see, and there's a broader effort, which is going to be longer term and is also problematic as to whether it works or not, to try to use this as a leverage to persuade Congress and administration to create policies that are going to incentivize increases in capacity and capabilities for biomanufacturing and for other kinds of services in the United States. Another thing to point out is that everything about Biosecure is a provision in the way that the law is written now. It all goes away if the Chinese biotechnology company of concern divests their operations. So I could see the clearest possibility, I have no inside information as to whether this is going to happen, would be Complete Genomics, because that's a standalone manufacturing company that has little ties to China. A little history on that. Illumina tried to buy Complete Genomics, and the Federal Trade Commission blocked it and said it was blocked it on antitrust grounds. But you could still see somebody maybe reaching in and buying that. There are rumors that are going around about WuXi AppTec or WuXi Biologics selling some of their operations in the United States. If you read the Financial Times story that broke that, you read it carefully. At the beginning, talks about that a lot, and then at the end it kind of hedges it and says, well, we don't really know. Maybe it's going to happen, maybe it's not going to happen. So I don't know about that either.
I always think that that US journalism is far more close on its sourcing than I'm afraid what we see from some of the UK journalism. So I would like to see it in a reputable
You're going to wait to see it
publication.
by a century before you can believe it.
Exactly, that's basically
right.
what.
That's right. I was going to say that, Steve. I think that's right. I mean, I guess one note I would make, and maybe this is just a concern of mine, is like the paranoid lawyer on the panel here, but I do worry a little bit that, let's say this does pass. I appreciate that your view might be a little brighter than mine, Steve, on that front. But let's say it does pass. I worry a little bit about how this is implemented directly, because this is going to be a law that each individual federal agency implements. NIH will have its own implementation. The Office of Management and Budget will have its, sort of regulations. The VA will have its requirements. And the folks on the ground who are asking the questions about the relationships with WuXi, BGI, et cetera, what will that look like? And so I do think that there's a need for some additional clarity there. Steve, to your point, conversation I have regularly with folks on the biotech C-suite and board front is about this idea that, well, even if we did need to move, even if we did need to shift, where do we go to? Where are the other resources? Where are the alternatives? And what kind of incentives will be put in place for that? I think that would be a great place for Congress to focus as well in the next term.
And ironically, I don't know if it's ironic, but one of the things that's happening, and I'm hearing also, is that because of the massive boom in the obesity drugs, the anti-obesity drugs, Lilly and Novo Nordisk are scooping up a lot of the excess manufacturing capacity, and that's giving people even fewer places to go. And I think that it's not just about manufacturing. Also, there's a very wide range of services that these companies provided on a very large scale. It's going to be difficult and time consuming. It's certainly not impossible, but difficult and time consuming to replicate those kinds of services in the United States and Europe and South Korea and Japan and so on.
Yeah, no, I think it's one that we're going to need to keep a close eye on. Thank you. That's been really useful in terms of some of the insight as to what may or may not happen. And I think we're just going to have to keep close to this as things move. And I think companies are making decisions through the fog of this. I mean, you have to make a decision, don't you, and to run your business. And people, you're not alone if you haven't got a precise view on this. I would say, Matt or Steve, it's no one has a perfect sense as to where this one's going. Maybe we can go ahead.
I was going to say, no, I don't think anyone has a perfect sense of where it's going, but I do think that this has raised enough concern in the industry, particularly around the front of sort of over-dependence on Chinese biotech companies, that I always tell folks, I've spoken more about Biosecure in just the past couple of months than I did about the Inflation Reduction Act over the past 2+ years. So it's definitely, rang a bell, is the expression I can't help myself but use in the industry, and I think we'll continue to hear that next year and beyond.
Thank you. I'm going to take the last few minutes to take you to what do you think, either some things that we're not talking about that we should be talking about in terms of US politics. You may have insights into things that aren't making the headlines that we ought to be talking about, or where do you think it's going in terms of the presidential election? We obviously, in terms of impact for our sector, I mean, we watch the news. It's well covered in the UK, and we can see that it's very close. But I wondered, Steve, your take as to where we're going to be on what we would call gunpowder plot night, November the 5th.
Well, I certainly hope we don't have any gunpowder. Enough of that kind of stuff going on. But look, you have to think about. It's not just about who wins the White House, okay? It's the White House, it's the Senate, and it's the House. I think that anybody that tells you that they absolutely have a lock on what's going to happen on any one of those ones is is probably exaggerating their own prescience. I have my views about what's more likely to happen. But anyway, you have to think about what happens in all three of those. I think that if you're looking at it solely from the point of view of the biopharm industry and not the whole world and not all the geopolitical issues, not all the other social issues, if either party gets a trifecta, if they get the White House and dominant control of the Senate and the House, there are policies that most people in the biotech industry would find highly damaging to innovation that are likely to be enacted. Okay, and on the Harris side, it would be extending the IRA's drug negotiation programs to much earlier point in time, earlier attempt to put it into apply it to the private sector, et cetera, et cetera. On the Trump side, it's a little bit harder to predict exactly what it would be. In the past, he's talked about international reference pricing. His campaign has backed off of that in the last few days, but it's not clear whether that actually reflects what he would do or what he wouldn't do. It's not a big surprise to everybody to know that what candidates say during when they're trying to run for office is not exactly necessarily what they're going to do once they get into office. So that's all very unclear. I think the other thing that's also very unclear about Trump or about Harris is what they're going to do, what kind of administration they're going to have. Okay, so with Trump, for example, his first FDA commissioner, Scott Gottlieb, was somebody who was praised to the sky by Republicans and by Democrats. Some wags in Washington say the only way that you could tell that there was a Republican running the FDA was that the TVs were tuned to Fox News at the security gates. Which isn't to say that he didn't have policies that were favored by the Republicans. He did, but he was really bipartisan, and I think everybody had a confidence that he woke up every morning and thought, what can I do today that's going to advance the health of the American people? And that's really what people want. Is that what we would have in a second Trump administration? There's a lot of skepticism about that. Is it going to be Vivek Ramaswamy? Is it going to be somebody who RFK Jr. Selects, or Peter Thiel, or somebody like that? There's a lot of anxiety around that. The same for who's going to be running the NIH. Trump left Francis Collins, who was an Obama appointee, in charge of the NIH. It's not very likely that he would leave Monica Bertagnolli, who's running the NIH now, in place. What's going to happen there? Very, very hard to predict. For Harris administration, is Harris administration going to be a continuation of the policies that we've seen under Biden, or would she have, would she want to see big changes at the agencies? Really, again, we don't have any information. We don't know what she would do, and my guess is that she probably hasn't given it a tremendous amount of thought, considering all the other things that that she has to think about right now. So those are some of the dynamics that I'm thinking about.
Yeah,
Thank you.
I might highlight, in addition to that, I think that's so insightful, Steve. I would focus on maybe three things that are a little bit off the beaten path. First, I'd look at the states, because the states are having elections as well. And right now at the state level, there are these prescription drug affordability boards, or PDABs as they're called, that are sort of mini drug price negotiation programs at the state level. These programs, if you look at them, they are all implemented in states with Democrat trifectas in both, the bicameral houses of, the state Congress plus the governorship. So that's a great way to kind of predict where we might see a new one of these prescription drug advisory boards come up. And they're a little bit different than the drug price negotiation program, because similarly, they'll select, 10, 15, 20 drugs to negotiate, but there they'll actually look at things like what's the actual out-of-pocket cost to Colorado resident, for example. So I think that's going to be an interesting dynamic based on how the state demographics might shift, or political demographics might shift. Number two, pharmacy benefit managers, PBMs. We're hearing a ton about this. If you look at the Trump administration, at the very tail end of the Trump administration, they had issued a rule under the federal anti-kickback statute that would have very narrowly limited the fees that PBMs could charge manufacturers, which of course is front and center as to the increased costs of prescription drugs in the U.S. The IRA, of course, delayed that rule by 10 years, was signed by President Biden. So I can envision a scenario in which the Trump administration, if that were to be the shift, might turn back to that former rule to get that implemented. Of course, that would require legislation because the IRA, put that into statute. I would also then point to the Biden administration's focus on march-in rights. And I don't know if we've talked about that previously, Steve. I'm sure we could have a whole nother session on march-in rights at some point. But when I think about
I understand it well from the experience during COVID about understanding what the US position is on that globally for behalf of global, terms of Pfizer or other things.
Well, and I think it's not only margin rights. Okay, it's more broadly. It's two issues. One is it's issues around intellectual property. That's the next battleground in the United States.
Yeah.
Drug pricing and affordability issues. If the biopharm industry waits until they can actually see exactly what's happened or what's being proposed, they will be behind the eight ball. There's a need to develop a kind of an intellectual discourse around IP issues and probably, I think, to start with acknowledging that there have been abuses and there have been things that the industry has done in the past that it should repudiate, and then move forward from that. And the other is antitrust policy. Okay, so you have an FTC now, which is deeply skeptical about any kind of M&A involving the biopharm industry. It's rate limited because it can only bring a certain number of cases a year. And the interesting thing is that there seems to be an alignment between where the Biden-Harris administration is on this, and at least where J.D. Vance is. He's praised them. I don't know what that would mean portend long term, but those are kind of two big issues to look at for public policy.
It is really interesting because if you think about it, we're in a position where we have a newly established Labour government with a significant majority in the House of Parliament, so able to take action. We think that those policies are going to be broadly supportive of the life science sector, certainly supportive of intellectual property, solid and based in science. The National Scientific Advisor, Patrick Vallance, has become our science minister, taking a seat in the House of Lords in the very strange way that we do that in the UK. But we seem, I would say, at the moment, very sensible on science and science in society. It is interesting that you talk about the potential for some of those characters that we might think of as having some fringe ideas from a European perspective. You're thinking that they could have actually positions of quite significant prominence in one case there. And then second is, I always think that the US is still trying to resolve how does it afford healthcare for the many, and therefore there's a continued political pressure to do that, whilst at the same time a desire to run very profitable global businesses at the same time, and that tension is interesting. And I think you're right that almost whichever way it goes, we will see certain policies that are endeavouring to deliver for those, whether, as Matt says, they happen at a state level with actual things that can make a difference in terms of co-pay prices for individuals, or at a trade level. And these are types of things that we're gonna see. It's not as if there's a straightforward back to normality position with either of the administrations in terms of the business environment for our sector.
Well, Matt and I are going to have plenty to do, regardless of what happens with the elections. These issues aren't, simply aren't going away. And the other kind of background, I think, to this whole thing, which is important, is also there's a great deal of antipathy toward the biopharm industry in the United States. You really can't overstate the importance of that. And I think overstate the importance long-term of changing that in order to get public policies that would be favorable to innovation and to patients. And it's coupled with a lack of understanding of how the industry works among policymakers, a lack of understanding in the White House, lack of understanding in Congress about the industry, and that fuels people who even are they're not ill-intentioned necessarily, but they inadvertently adopt policies that somebody that doesn't really know what they're talking about or really doesn't understand the industry thinks makes sense or thinks would be good for innovation and for.
I couldn't agree with you more on that front, Steve. And I do think that Steve Bates, organizations like yours and pharma and bio in the US, just really making a push on, the public reputation of the industry. It's so bizarrely distorted. As somebody who's been a private practitioner for 20 years in the biotech, medtech, and pharmaceutical industries, this is great technology, life-saving, life-changing. The people who are behind this technology are patient-focused and thinking about how to cure and rid the world of diseases. And so to, go to work every day with that in mind, but then to be faced with a reputation that says the complete opposite, I think that's really got to be an area for work for some of the groups like yours,
Yeah,
Steve, that are working on that.
We continue to fight the good fight there. I will be putting up a new all-party parliamentary group on life sciences, starting with the new parliament next week to try and do some of that. We've got our recent mRNA explainer, trying to help people understand what that technology is, what it's got, what the capabilities are. It's not simply a COVID vaccine technology. We keep doing that, and I think we're very lucky in the sense that because drug pricing is not an issue in the UK, the concern is with the health service and its delivery to patients. People are very concerned about that, but it's not seen through the prism of a drug industry, and there's much less laid into the prescription price in the UK than there is in co-pays in America. So we are in a different place, and I hope the reputation of some of the things that we did during the pandemic in terms of rapidly developing therapies and particularly vaccines is still plays in the popular memory here. I'm conscious that we're near the end of our hour. I'm going to go to final comments, Matt, and then Steve.
No, I appreciate it, Steve, and thanks for the time today. Thanks for the chance to talk with you and your constituents. It's always a good conversation. I think we're in such a dynamic spot in the United States where there's a lot of work to be done on multiple fronts. I think we'll see a lot of, additional information and learnings from the IRA next year. I think we'll see a continued push on relationships with Chinese biotech companies, whether in the form of Biosecure or otherwise. And I think we'll continue to see, whether it's a Harris administration or Trump administration, a push on pharmaceutical pricing, whether focused on the right, players in that or not. That will remain to be seen, but always appreciate talking about this with you.
Well,
Matt,
thanks.
thank you.
Thanks again. I didn't say it up front. Thanks for inviting me to participate in this and talk about the things that I talk about and think about all the time. So it's really nice that there are other people who care about it and are interested in it.
No, we have. I encourage people to provide us with any feedback and comments. And as we close, I'm just going to thank our annual supporters: AstraZeneca, Avantor, Cytiva, Cooley, HSBC Innovation Banking, J&J, and LifeArc. I'm going to encourage people to remember that we've got a fantastic range of events running across the autumn. Tech Bio is our conference next week. Some really good speakers there. Remember, that will be after the UK government's Innovation Investment Summit at the weekend. So it'll be interesting to see if we've got things that have moved in our sector by then. And if you're interested in regulation, our event with the MHRA on the 6th of November is one to look out for. With Steve here, I must promote London Life Science Week. Have a look on the website there. There's loads of people coming through London from around the world for that week, centered around the Jefferies conference. But we've got a great event on the Tuesday evening in partnership with Biocentury, a CEO investor dialogue, which I think will be really good and put in context some of the great deals that we're seeing, some of the great innovations we've got there. And if you haven't booked your tickets, the gala dinner is at the end of January, as ever, once again in the Camden Roundhouse. Steve, it's seen the Rolling Stones, it's seen Amy Winehouse, and now it sees the BIA having lots of fun. So used to be in a locomotive shed, now it's the place that we go for our gala. So we look forward to seeing the Biocentury gang through. I know you won't be making it in November, but your colleagues will, and we look forward to seeing you all there. With that, Steve, thanks very much. Matt, thank you very much. Thank you, everyone, and look forward to seeing you at a BIA event soon. Thanks all. Goodbye.